Okay, it's a little bit after the hour by a minute or so. So as people are continuing to join, I want to go ahead and get started. I'm always surprised when we have these informal conversations how quickly an hour passes. Welcome. I'm Mary Minetti, and I work as the Senior Policy and Program Specialist at the Institute for Patient and Family-Centered Care, and I'll be the moderator for today's PFCC Connect Informal Conversation. The topic is PFCC partnerships across the continuum during COVID-19. Where are we now? And I'm joined with my colleagues, Marie Abraham, who's Vice President of Programming and Publications. Welcome, Marie. We're glad that she's here. She is going to be monitoring the chat and will help make sure that as people share things in the chat, that if I miss anything, she can call it to our attention as the hour unfolds. And then, of course, we're also joined by Natasha Reed, who is our technical support specialist. And thanks, Natasha. She's the person who makes it possible for people to register and send out materials afterwards and record the conversation for those who aren't able to join. And you'll notice that there's a quick poll about your role that as you can, we'd appreciate you filling it out. It's always nice for us to see who's on the call and know what roles and perspectives that they're representing, knowing that every perspective is valued, and we want to include all those ideas and thoughts together. So for some of you, I've seen your names and you've joined and met you in other venues and have had you participate in COVID conversations. Some are new to me, and I welcome those of you that have not been to a conversation. We've hosted a number of informal conversations on the topic of COVID-19 and the impact that it's had on patient and family-centered care. And today's conversation is the beginning of taking the conversation to a deeper level. And so it's really a conversation where I'm really going to be trying to pull information and ideas and suggestions and have you help provide some input into the next few months of these conversations. So I think we probably have had enough time for people to fill out the poll. Great, right on time. Thank you so much, Natasha. So this is a great representation of patient and family or resident advisors as well as coordinators. So almost half of you are patient, resident, or family advisors. And then, of course, where would we be without the coordinators who are responsible for PFCC initiatives? And we've got some patient experience and patient relations personnel, as well as clinical leaders, physicians, quality improvement staff. And I'm always excited to see people from the community be represented. One of the things that I would appreciate those of you that chose other to do is to chat in what your role is if you don't see it listed, so that we know who other represents. But I so appreciate those of you that are that took the time to share the poll. I think it's great that we've got such a strong representation of patient and family advisors. So if we can go to the next slide, that would be great. So if you want to chat in your name and your organization and your country, we have people generally from North America, Canada, and the United States, but every once in a while we do have somebody that's a little farther away from North America, and we love that happens and that people choose to join us. The goal today really is to solicit your input and learn together. And there may be opportunities for you to chat in and share some resources or some ideas, so we really appreciate that. It becomes really important to us that happens. So we know that a number of you are patient and family advisors, and then across the gamut of other kinds of roles, which is really important. If we can go to the next slide, and I see people are coming from all over, from Connecticut, Delaware, Iowa. This is just wonderful. South Carolina. I myself am from Eugene, Oregon. I don't know if this is happening in your garden, but there's a lot of dahlias blooming in my garden, at least the ones that the snails haven't eaten. And it is a beautiful time of year. So if we can launch the next poll, which really is not just your role, but I'm very interested in knowing across the continuum of care, what setting are you participating in and influencing or working in a paid position? So we've listed a number of places, and you'll notice that we've listed a couple new areas because we really want to explore and reach out to those areas as well. Obviously, hospital medical centers are a big part of the environment that we work in, but continuing care communities, which includes long-term care, assisted living, and retirement communities, is an area that's been impacted by COVID, as well as home health. And then community nonprofits and government organizations have been very busy responding to some of the fallout that is not direct, that affects health, like food insecurity and unemployment and those kinds of things. And so I'm interested in knowing if we've got some people that have been working in those settings. So I see that people are busy chatting in where they're from, and I think that's great. If you can take a moment and fill out the poll, that would be wonderful, so we can see where people are represented, and then we'll move into the conversation, and I'll set the stage for that conversation. I noticed that we continue to have people joining the call, and we had over 90 people, I think, register to join the call, although some often join the recording if something comes up in their work setting or their home setting. So, but we're at 54 now, and that's a great group to have together. So if we can see. Okay, so we've got primary care represented and ambulatory and outpatient care in small numbers, about a third in ambulatory care, 72%, so a majority are from hospital medical centers. A small number from continuing care communities. Thank you and welcome. We appreciate you being here, and as we continue these conversations, I really want to invite you to reach out to other people in continuing care communities within your network to join us for some of these ongoing conversations. We'll want to spotlight what's going on in continuing care as part of this series. And home health is represented, and that's wonderful. I think this is one of the first times we've had home health represented. And again, if we, for those of you that have indicated other, which is 9%, if you can, also chat in what other represented. And we've got community, nonprofits, and government organizations, so that's great. So we've got research institutions, so I appreciate that, Jim. We'll try to make that more explicit in our polls in the future. If you want to go on to the next, this next slide, let's talk a little bit about why we're here and what we're about in terms of this deeper dive related to the COVID-19 conversation and supporting PFCC practices. Our goal in these conversations is to provide a resource and clearinghouse for up-to-date, easily accessible information about ways to stay grounded in PFCC's core concepts. And as a result, we have been funded with a grant from the New York State Health Foundation. We're very thankful to them. They are going to help fund IPFCC identifying, developing, and disseminating information related to COVID-19 across adult healthcare settings. And this is kind of a companion effort because we also have smaller funding, but important funding in the pediatric area from Lucille Packard Foundation at Stanford. And so between those two fundings, it allows IPFCC to dive deeper, to connect and outreach farther, to support individuals and organizations as COVID continues to ravage this country and really challenge us to keep true to the principles of patient and family-centered care. In this grant, our target audience in today's conversation is going to be about adult healthcare settings across the continuum. And you saw a number of them mentioned in the poll, and we have a number of you representing those environments, and that's great. Our hope is, because this is a free effort and we're going to be offering a number of resources that are no cost, that we can really expand the network of individuals who get access to this information. So we're going to be offering free webinars, 4 free webinars, and continuing online conversations. This is the launch. The funding started yesterday and will continue through March 2021. And so again, we really thank the New York State Health Foundation. The next slide, please. It really lists the dates that we've identified for the informal conversations and the webinars. And so you'll see that our next informal conversation will be August 10th, and it will be informed by the information that you share and the priorities that you share this today, and that we also gather from an advisory council that we've put together that is representative of New York State organizations and people across the country, and in all of those settings that we talked about. So, and then our first webinar will be Tuesday, September 15th at noon. And so, again, this conversation and other outreach that we'll be doing between now and then will inform and help identify speakers for our webinar in September. So next slide, please. So today's conversation really is kind of a reflective one and a hopeful, proactive one, because we're going to be thinking about where we are now and where we go from here in terms of these conversations, in terms of providing a resource, in terms of providing a network and a learning community that can help disseminate information that's useful so that we can continue to expand and support important partnerships with patients, families, and residents of CCRCs. Again, that's continuing care, retirement communities. That's kind of a new, it's broader than just long-term care. It includes assisted living and retirement communities, but all of those settings, as I said earlier, are affected. So if we can go to the next slide. I wanted to just reflect on kind of where we are now. So the Institute for Patient and Family Centered Care, if you're not aware of this, we have launched a special site on our web page related specifically to PFCC and COVID-19, and that's where we have spotlights on organizations. We link to helpful resources. We certainly are not the only organization across North America and beyond that really is having conversations about COVID-19 and identifying best practices. And so our role as a clearinghouse is to develop resources where there are gaps, but also to link to resources to make it easy for people to access information that's helpful to them as they're trying to grapple with how to maintain and sustain important partnerships between healthcare organizations and providers and the people and their families that are served in those environments. So one of the ways that we've done that is to gather some information and put it on our website so that it's available for everyone. The next slide, please, is really just a reminder for those of you that are in hospital settings, and I know that that was about 70%, that there still is a new survey for tracking the impact of COVID-19 on PFCC. And you can both complete the survey, and the link is there, and perhaps Marie can put it in the chat as well. And you can see the results of so far. It's a rolling survey, so people can continue to fill it out and share what's happening in their organizations. And that survey will close at the end of this month. So if you haven't filled out the survey or you don't see your organization represented, we encourage you to share it broadly. I know that there are some of you from organizations that are networks to hospital systems across the country. So if you have those networks, I encourage you to share that. So we've been gathering that information, and as we it's one of the ways that we're being able to do some outreach and interviews of hospital settings that we think are doing some innovative and best practice kinds of things related to COVID um, partnerships. So next slide, please. So things are changing. There are a few places that are beginning to open up with obviously some safeguards in place so that even in nursing homes, some visitation in a remote way is possible. And I think that we need to be very careful. I think when COVID first hit, we really kind of locked everything down as we were trying to discover what's going on and maintain PPE. And now we're still, you know, and things seem to calm, and now we've got another surge. And so we have to be thinking about that this is kind of, at least until there's a vaccine, COVID is going to be a kind of a chronic condition that we're all going to be living with. And we need to balance safety of all with recognizing that long-term isolation and disconnection from family and those people that support vulnerable individuals can have long-term emotional impacts. And so we want to balance those things. So it's good that there are beginning to be places that are experimenting with that in a variety of settings, not just in nursing home settings. Next slide, please. We've discovered, in terms of where we've been, that telehealth has been a technology that, although it doesn't replace totally the value of a face-to-face visit, it can take care of a number of issues in a safe manner in primary care and ambulatory settings. And so hopefully, as we begin to explore our new normal and how we're going to provide people with a variety of options in which to receive care, that telehealth will still be in that mix. And we need to be gathering what are the ways that we're preparing patients and families and making that a useful tool. And how are we working across communities to make sure that that there isn't a digital divide, and that we don't, as there have been disparities among African Americans and Latino populations, that we don't continue that disparity as we provide telehealth as an option. So if we can go to the next slide, the reality is that people are coming home, and that there's much to celebrate, both the healthcare workers who are on the front lines and the essential workers that are in our communities, and that we're in a marathon and not a sprint. And so we need to think about how we take care of each other, and what information and conversations are going to be most important to us as we try to make sense of this environment, and how we can really manage partnerships so that they're authentic and meaningful, and that care is delivered in kind and compassionate ways, and information is provided in ways that are affirming and understandable, and that can really engage individuals to dampen the fear, to be informed, so that we can take meaningful action together. So as part of this, this New York State Health Foundation launch, since we've had conversations before and we've done some things related to COVID and conversations and free webinars, we wanted to reach out to you and to others. So this is one way that we're reaching out, to really find out what matters to you, what's important, what do we want to focus on in this next 9 months. And we know that that's going to be fluid and it's going to change, but we're kind of taking a pulse at this moment. And so if we can, Natasha, put up the poll so that people can share with us what kinds of possible webinar topics might be useful to you. And so we brainstormed some. We looked at some of the information that's been coming in through the chats that we've had before in terms of questions that people have asked. And so this is not the only thing that could be a webinar topic, and these may not be the right webinar topics. So, so we've offered you an other. Please post in the chat what might be a other topic that you would suggest that we focus on. We've got opportunity in 4 webinars. We'll have 7 conversations, and so we can dive down into conversations and shared learning in the informal conversations. But by providing us with some feedback about webinar topics now, that helps us begin to identify and go out into the field to find speakers and individuals who can help provide some spotlights on great things that are happening. So if you can take a moment, I know there's a lot of words in this poll, but if you can take a moment and identify the things that you think are priorities for webinar topics. And again, feel free to use other liberally, because I don't claim to be able to have guessed what is important to people. Daniela, thank you for sharing the issues of addressing racial and ethnic disparities in COVID-19. I think that's a very important topic.
I have about half of the responses, Mary, so I'm going to give it just a few more minutes or seconds.
That'd be great. It's kind of a full of words poll rather than just 1 or 2 words. So yeah, we want to give you opportunity to share that. I just recently, actually, Carol Levine is on the line, and she sent me a link to some articles. Carolyn, I don't know if you have completed the poll yet. If you have, if you want to share that link to some of the articles that you sent related to COVID-19, I think they seem to be hot off the press.
Are you talking to me? I was, Mary, are you talking to me?
I was
Okay.
asking you if you wanted to put the link to those articles in the chat.
I was in the chat saying something else, but I will send that separately. It's a series. It's a series of blogs from AARP, Public Policy Institute, on this very topic, and they're doing some very similar kinds of environmental scan to see what's going on. So I will send that link in the chat if I can manage to get back to my thing. Okay.
Great.
You know.
Thank you.
Okay, thanks.
Nothing like a little multitasking, huh, Carol?
Okay.
So one of the things that IPFCC really values is collaboration, and that is why we're hosting this conversation, and we're going to host ongoing conversations. But we also want to link to others in the larger community, because we want to bring that knowledge and disseminate knowledge that's useful, and really focuses on how we can create and maintain authentic partnerships. We've worked for many years related to patient and family-centered care to build partnerships and make them just part of the way we do the work. Oh, great. So we've got some responses. Okay, so disparities and looking at innovative partnerships is something that a lot of people that completed the poll shared. Addressing behavioral and emotional issues. Great. So we keep the results of the polls and the chats, and so we will take a closer look at the poll and really begin to work with our advisory committee and others to ferret out where those innovative partnerships are and bring those to the forefront, as well as some of these other topics. And I'm glad that there's an interest in that. Is there a way, Natasha, for you to put the poll up again so that we can look at it? Because what I want to do now is I want to be able to just open the lines. Thank you. Open the lines a little bit and ask people to share if they know of some innovative places or if they have some ideas related to things that are going well or that you've seen in your community or in your organization related to any of these topics that have some interest, especially behavioral and emotional health issues, anything related to family presence that really becomes, continues to be a area of great pain when individuals are with COVID are unable to be in contact with their families as their health deteriorates. So I'm going to open the phone lines. I see a lot of people are on mute, which I appreciate when we're just kind of getting things set up. But I do want to begin to hear a little bit from people about what they're hearing out in the field, what innovations they may be having happen in their institutions, and see if on any of these topics people have ideas of who might be people we should reach out to.
Mary?
Yes.
This is Jim Pantelis.
Hi, Jim.
I have a thought on the family presence, and that's just that in a pediatric setting, we seem to have figured out that peds patients need family there. At Mott, we allow one patient to stay with the child, and they've managed to limit it to one parent and to not allow that parent to leave the room other than to leave for the day, whatever. But if we figured that out for pediatric patients, why haven't we figured that out for adult patients? It seems odd to me.
Mm-hmm, mm-hmm. I agree. And I also just was reading an article, and I'm sorry I can't quote the article, but we'll make sure that it's in the chat folder, about that even in pediatrics that there are some pediatric area. Oh, it was in the PFCC Connect conversation where there have been some institutions where they've begun to realize that only one parent isn't as useful as having both parents because they support each other, and that in terms of respite, when families have other obligations, whether it's childcare obligations or work obligations, if there can also be a third person, not all three at the same time, but so that there's an opportunity for support and for respite. And so I think that nursing in particular has really experienced the vacuum that's created when family presence isn't there, because the gap falls on nurses in a really difficult way. Angela, I see that you are really interested in how do we go forward with the roles of PFACs and advisors and how might they change. And so that certainly could be part of a conversation and webinar about what different organizations are doing related to, and what different advisory councils are doing in new ways, not just new technologies, how they're connecting, but what kinds of work and collaborations they're having. So that's really important. So,
Mary, could I just say something on that?
You bet. Who is this?
This is Angela.
Great. Yes, Angela.
Yeah, so I actually had this conversation about an hour ago with a colleague in South Florida. I'm in North Central Florida, and we're both, you know, we are in two different hospital systems, and we were both talking about how, you know, the advisory councils either aren't meeting at all or they've been meeting virtually. And my colleague was saying that in South Florida, she is anticipating not, as an advisory council, not being allowed back into the hospital physically at all this year, most likely. And so we were just talking about, you know, what now will be the role of advisors. How can we maintain, you know, our influence, and even just in this, the fact that we're not there to support other patients or parents, which has been part of our role. And you know, I'm sure this is an issue across the country, and I was just curious as to how people in other parts of the country are thinking about this as we move forward.
Well, we have a number of patient and family advisors on the line. I'm wondering if anyone from another part of the country wants to talk about what they are beginning to explore, what they're doing in their areas. Anyone?
Hey, Mary. This is Caroline DeLongchamp
I'm
in
good.
Charleston.
How are you, Caroline?
Good. Yeah, this is the main thing that I think folks in my role are eager to talk about and hear what others are doing. I think it's a great opportunity. All of our PFACs moved to a virtual format in March. And in many ways, we've seen greater engagement, both from our care team members, our staff, and our advisors, because it is easier. We've been talking about this for months, but it's a little bit easier to participate now because we've gotten rid of the barriers such as parking and, you know, childcare and things like that. But there is this huge barrier, the difficulty of creating relationships, which is the gist of everything that we do in a virtual format. The good news is that else in our hospitals is
Oh, you cut out a little bit.
perfect
Caroline.
opportunity. Oh, sorry. My
No,
back.
Yep, you're back.
You hear me?
Yeah, we
Okay.
only missed about
But
3 sentences.
Okay, sorry. But our advisors to stay involved, because it feels like you're still in the hospital and you're still engaged and seeing what's going on in some of the units and being part of
Mhm.
Our children tends to lead the way. I think that's part of my role, is helping the adult side see some of the great work that's going on over there and try and bring it over to the adult side. Can you still hear me?
Mhm.
Sorry, am I going out?
Yeah, you're kind of going in
Anyway.
and out.
Sorry.
You are not the only
It
one
says
that's challenged with technology today. So it may be, Caroline, that if you can make a comment, or maybe we can do an offline conversation. I can gather some of the information that you're sharing and post it on the PFCC Connect for other individuals. Sorry about technology. I wish I could wave my magic wand and it would be absolutely reliable, but unfortunately it's not. So I'm wondering, we have Karen Karen, I'm probably mispronouncing your name, but you're a resident advisor at a CCRC. Can you talk a little bit about what some of the issues have been in your setting? Karen, I think you're on mute, so I can't hear you.
Now good.
Oh, there you go. Can hear
Okay.
you now.
We are we run the full range from independent living, assisted living, SNF, and memory care. And I'm happy to say that we have never had one resident or staff member infected through today, and everybody has been tested. You know, as far as improving visitor relations and maintaining that important family contact, That's been tough because we haven't really allowed visitors in. Of course, everybody's wearing a mask, but some of the things that our staff have done is to engage the people in assisted living and skilled nursing. They're in 1- and 2-story buildings, and they have erected little tents like the pop-up tent you see at the beach in front of the windows, and they encourage family members and visitors to come to that particular area where their loved one is and talk via a phone. And so they can see each other, they can touch the glass and so forth. And I think that the staff has been really working to maintain a positive relationship with the families, knowing which patients really need or which residents really need more family connectedness. And then, I don't know if this is terribly relevant, but we have our cocktail hours through the Zoom format. And so we encourage social interactions with residents via Zoom. So, and I don't know, Mary, does that help with some of the things?
Yes, we haven't had a lot of conversation about the CCR bit into what is possible is always helpful to share. I know that there was a comment about if we have a family member and it's scary because maybe they haven't been there before, and we hear things are so locked down and what's possible. It's always nice to know what's possible. And there seems to be agreement that happy hour Zooms sound like a good idea.
We also are blessed by some large grass areas, and there's a group of residents that independent living residents who get out every day, weather permitting, this being the Northwest, for cocktail hour from 5 to 6, and they bring lawn chairs. Everybody brings their lawn chair, and they sit 6 to 8 to 10 feet apart, and they don't wear masks because they're sipping their wine and they're chit-chatting, and everyone agrees that that little bit of outdoor interaction with people makes going back to your apartment 100% better. And we also try and independent residents who know people who are in assisted living and skilled nursing make every effort to try and include them, like I say, with going to visit them from the outside on those tents, or communicating with them via Zoom, because we also have the Zoom cocktail hours for for assisted living and SNF patients as well, or residents as well. The staff, I should say here, has been remarkable. They have really worked to encourage, to keep everybody's spirits up, and to they act more like family in many cases. There are several individuals here who really don't have family close, and the staff has really been a good substitute for them. Of course, everybody's tested that walks in this place, no visitors, but everybody who's walks in is, including staff on a daily basis, tested for temperature. Mm-hmm. They have tested all the residents, staff, and the independent living residents, and all the results have been negative, which is happy. But I'll tell you, our CEO has not waited for the state to come with a testing protocol. Before it all started, she had 3 staff members trained on how to administer these tests, and had made arrangements with a private vendor to supply the test kits. So we were really, I think, quite fortunate, in part because we have a very alert staff, and in part because people here they care about each other. Yeah. When you don't have family, you have your friends and neighbors.
Karen, this has been really helpful, and in the interest of time, I need to move on, but let me ask one quick question that came up in chat. Is the management of your organization asking you as a resident of this facility for your input and advice? Is there partnership
Absolutely.
there?
Absolutely.
Resident
You bet.
council?
And we have the CEO has chats floor by floor on a monthly basis where she notes all the feedback and writes it down, and something happens. You know there have been some results, not always what you want, but you know that person, she is listening and delegating where need be. But the staff has been very responsive to us and has tried to incorporate the residents' feedback in the new policies that are being made.
Great, thanks. I know that our bandwidth may be being used up a bit, and Lee Stress MD said that we can try turning off video for participants to leave more bandwidth for audio. So for those of you that want to do that, if we want to try that out, I think we can do that. There's been a number of really great things happening in chat related to, Marielle was talking a little bit about their virtual family advisory councils. They've had better attendance, but there's been I know some have struggled to find agenda topics because providers have not been seeking out feedback as much. So, how do we have other people had that experience and been able to address it? And Lillian, I see that according to our wonderful chat monitor that you've raised your hand and I didn't notice it. So if you have something that you want to share with the group, please, I welcome your comments.
Well, can you hear me?
I can.
So mine went back to the visiting and in the pediatric and the adult side, if it's okay to go back to that.
Oh, you bet.
It's an interesting thing for us as management to try to tell the parents that we are limiting visitors because we are trying to limit exposure and the science behind that and everything. But in my PICU, for instance, I'd say 70% of the staff are less than 35 years old, which if these families are watching the news, supposedly those are the people that are still meeting together and going out and kind of infecting each other. And so how do we reconcile that with parents who say, I really want my mom to come be here with me and my baby's grandma? I know she's not going anywhere. And I listen to these parents tell me that, and I feel like such a jerk because they're right. They have no idea where I went after I left the hospital and then came back. If I'm one of those silent carriers, or if I'm going to get sick in 2 days, but I've infected them today. And so it's getting this disease, bringing it to. So how do we intellectually the parents can understand it, but emotionally it's awful. And on a personal level, my husband was in the hospital 2 weeks ago in my hospital where I work. And even though I was okay to come and go 24/7 working, they would not let me stay with him past like 6 p.m. Now, did I push the envelope and stay till 10? Yeah. I don't think anybody really wanted to kick me out, but they did in the end. They were like, you really need to go by nighttime. And of course you can come early in the morning, earlier than the 9 a.m. visiting time because you work here and you would be here anyway. But it's a hard thing, and it's hard to wrap your head around the logic of it when it doesn't really make sense to the parents.
Yeah.
So we're always looking for the exceptions. I have a family today who 4 of the siblings are coming to see this kiddo. 1 is a twin and the other 3 are older, and they are like all older than 15 years old. And so we're going to have 6 family members in a room today, and all of our management is happy to make it happen. So we're looking for the exceptions, but You know, what about when my husband was in the hospital? There is no exception for that. You know, when you're a family or a patient in the hospital, you are the sickest person in your mind.
Right, right.
So anyway, just some thoughts of, you know, how do we help them to understand when it's really not understandable?
Yeah. There's been some, thank you for sharing that. There's been some interesting conversation around how PFACs are being utilized in this virtual new world. And so Jim's talking in the chat about an effort to get greater participation at committee levels on ethics and pain management and floor management level. Sounds like that's just started, Jim. Do you have any observations about how that's going?
It's at a hospital that is relatively new to PFACs, but it's trying to mirror what's happening at more established PFACs, and it is working. It's keeping our membership active, even though it's virtual. And it's bringing into the central PFAC meetings more information, because in the central PFAC meetings suddenly we have no caregiver or clinician participation, because they're running like crazy, and we don't want to be a distraction for them. We don't want to pull them away from what they're having to deal with right now. But it still keeps the PFAC going and viable. Getting the patients in front of the clinician community is really important.
Great, great. So in the interest of time, I want to share some of the that came people at registration. So next slide. So my computer's kind of doesn't come up. I don't know if it's for other people, but I'm going to start talking about what's on the. Oh, there. So what I'm be 4 kind of topical areas keep again and again, which are good. One is all the questions and the interesting conversation around the partnerships. What are people doing to maintain engagement? Are we checking in with our patient partners or family partners or resident partners to see if they feel engaged? Do they have ideas about topics that they'd like to explore with us? And how are we tracking, if there were some initiatives that we were working on in our patient and family advisory councils, are we still tracking that and kind of reporting out on it? And I did notice in the chat that somebody said that in the virtual world, there are people that our attendance is up and the participation is higher because we've removed some of the transportation and other kinds of barriers. We talked a little bit about what's happening in other settings. At least Karen shared what's happening in the state of Washington. And they were an epicenter at the beginning, especially in the long-term care community area. And so it's good to know that there are some positive things happening there. The other things, if you can go to the next slide, that people want to talk about, and I'm thinking people may have something that they want to share about, which really has to do with the direct care impact. How do we address people's emotions when they have emotions around the changes that are being implemented, and how are we doing communication and dealing with end of life and isolation, and are we tracking what's happening to patients who are non-COVID that have chronic conditions whose care has been delayed? These are all, and for those of you that are researchers, these are all important questions that we want to know right now, but we also want to know as a population. So these are some of of the questions that people are interested in having ongoing conversations about. And one of the ideas that I had, and I really we have to say it, but it may be that perhaps we want to have a conversation on direct care only, and we want to have a conversation of long-term care only. So what do people think? How best can we use this mechanism of our PFCC Connect conversations to address these issues that people are interested in exploring together more? Thoughts?
Mary, this is Marie, and just wondering if you would mention the Packard pediatric COVID informal conversations that are going on as well, because it might be helpful for people to know if they don't know about those.
Okay, great. So we have a similar grant from Lucille Packard Foundation, and we are hosting webinars and informal conversations that are focused solely on pediatric issues. And the next conversation, the next pediatric informal conversation will be on, I'm double checking my calendar so I don't misrepresent it, but I think it's on the 28th. Yes, on the 28th at noon Eastern time, that's July 28th, we're gonna have an informal conversation. The topic is going to be on parent mentors and preparing parent mentors to have a role during COVID-19. And then that'll be about half of the conversation. Children's National is going to be leading that discussion. And then the rest of the hour will be spent just sharing what is happening in pediatrics and what people are most concerned about. And then there will be a webinar for pediatrics on the 13th of August at noon Eastern time. And that information, more information about that can be, you can send me an email if you want more information about that, and I can make sure that you get the registration links and the topic about the webinar that's coming up. I can't remember about, Deborah Dawkin is handling the webinar, and so I'm not sure that I know the latest and greatest about that. But so that's happening. Renee Marcus suggests that it would be great to talk about how to engage lower income advisors who don't have tech access. That's a really important issue, is how do we not exclude individual voices that are important for us to hear, especially as we think about health disparities and those kinds of things. So that's a good reminder. And then Marie's put some information in terms of spotlights on the organizations who are engaging PFACs, and we can add more organizations as well. If we can go to the next slide, are there other burning issues or concerns that haven't come up in the chat so far and haven't come up in the kind of the outline of some of the partnership and direct care and other community settings issues that we should be mindful of? That because in addition to these webinars, bringing in doing certain things out in the field that maybe that are innovative and kind of best practice and kind of help propel the field forward. We do have a little bandwidth to go out and create some new resources or find and link resources related to issues or concerns that people feel are gaps and are not being addressed during COVID-19 that diminish partnership. So are there any other burning issues or concerns? You can either chat them in.
Carol?
Or you can talk about them, yeah.
Okay. Since there is such a wide variety of locations, that also means there is a wide variety of political context in which everyone is operating. And that affects the policies and practices that go on in institutions. And I think it would be good to at least raise that issue. How do you deal with the very conflicting reports that people get and information they get and what they believe, and how do you both respect their right to believe that, but make the policies based on the science and the facts as we know them at this moment.
Mhm.
It seems to me it's kind of like the elephant in the 800-pound elephant, because we're all dealing with it in some way or other, and it's going to be here. So
Mhm.
it's a little touchy, but I think it's part of the context.
Mhm. Mhm. Context is really important. And how do we, you know, when we think about the PFCC Connect or PFCC, Patient and Family Centered Care, is all about respect and dignity and honoring people's values and preferences. And how do we have conversations so we can hear about those things? And how can we share useful and affirming information in ways that are important? So I think we want, you know, partnership is based on participation and that respect. And so how do we contextualize and build partnerships across whatever the divide is, whether it's a health disparities divide or a political divide or whatever. So there have been a lot of great things happening in the chat, and we will summarize those, and they will be available in the PFCC Connect area. And if you have other burning issues, we want to be sure and hear about them. So feel free to contact us. If we can just go to the next couple of slides, I'm going to have to wrap up because it's almost at the top of the hour, and I want to be respectful of your time. An hour is never enough, but there are more conversations to come. So in PFCC Connect, our next steps are that we're going to make sure that all of what has been talked about today and written about today is shared in our PFCC Connect learning community. There is, and Marie has put, thank you Marie, the survey link to the conversation. And our evaluation of today's conversation is just a little bit expanded, not that it's going to take you a long time, but I also have given you an opportunity within the evaluation to list some additional topics and issues that you think are important for us to consider that you may not have been able to share during today's conversation, or that you may fill out this evaluation tomorrow and something may come up as you're thinking about the conversation that we've just had. So the survey is a little, not just talking about today, but also looking forward in the future. And then if you have examples or tools or resources, if you want to share those directly with us by email, or if you want to place them and load them into the PFCC Connect community, we really encourage you to do that. I know that there have been some great conversations around family presence and that are in the all member community conversation, and a letter that Terry Griffin wrote to her son who was becoming a healthcare provider, and really talked about the importance of relationship in that work with patients and families. And if we can go to the next slide. So I encourage you to go to PFCC Connect. I want to remind you that IPFCC's virtual conference is just around the corner. It's in a different format, obviously, because we're not all going to come to Nashville, although we're going to bring some music and things from Nashville to you. But there are some amazing breakout sessions, and we're going to have Ask the Expert sessions as well, interactive poster display, and a number of ways to connect with presenters and fellow attendees. And it's a much less expensive alternative than traveling to Nashville. So if you can join us, we really encourage that. If you happen to be in New York City or in the state of New York and are a patient or parent or family advisor, New York State Health Foundation does have a process by which people can apply to attend conferences, not just ours. So you might check that out. If we can go to the last slide, I want to be sure that you know how to connect with us. So there's both my email address and Marie's. we appreciate this conversation. It's the beginning. Well, it's a continuation, but it's a beginning of diving a little deeper into these very important issues. And things are continually changing, and this will be, as I said, a continual challenge, because we're not in a sprint here, we're in a marathon. And as part of being in a marathon, we have to renew each other and ourselves by sharing best practices, by taking a break, by remembering that there are things that we can learn together, and by being together, we can what. So take and have a great rest of your day.